We have about 2,000 active patients that we take care of here at the clinic. Most of those folks have a chronic disease such as diabetes and hypertension.
My name's Cheryl Ingetz. I was having a lot of health issues. I had a stroke in '85, and then in 2013 I had a heart attack, and along with other health conditions. I didn't know where to go. I didn't know what to do. I'm raising a grandson that I've had since he was a newborn. I didn't have no means of funds or anything. And so I was recommended to the health clinic up here, and the doctors that was looking at me, they kept listening to my neck. And unfortunately, the one side of my neck was completely blocked, but the other side was 80% blocked. I was stressing out, wondering, okay, since I can't afford to have this surgery, what am I going to do next? Is there a chance that, I'm not going to make it? What am I going to do? I was scared for my own life, not knowing, am I going to make it to the next day? Am I going to have that help that I need in order to get better?
If she had not come to our office and she received no further treatment, I think she probably would have had a massive stroke eventually and not survived. She's a lucky woman.
But with the help of the clinic and the staff and everything, they got me on Medicaid. They got the help that I needed to where I was able to get the surgery that I needed, that I would not have been able to afford on my own. If I wouldn't have got the help that I needed, then there wouldn't have been nobody there for my grandson. And I feel so much better now. I thank the clinic up here too, the people that run it, for giving me the support that I needed, because I probably would have gave up. They were my inspiration. They kept me going.
I was in Columbus, Ohio, and I was staying by myself, but I was real sick with the sugar diabetes. I felt like I was real ill and I was alone. So I'm thinking, if I'm gonna die, I need to go home and be with my family. But when I came back here, I was blessed to come to the Forestry Health Center. They had got me on meds, but at first my insurance didn't want to pay for it. So I felt very hopeless. I was very afraid. My family really didn't have money, for my medicine. But the doctors, the nurse practitioners at the Forestry Health Center, some of them went in their pocket and got my medicine and got me together. Since I've been to the clinic, I've seen a foot doctor, a gynecologist, an eye doctor, and a heart doctor.
You go into the exam room and you can see the look of angst on their face, but when they leave, they just tell everybody, thank you for being so nice, thank you for trying to help me. That's what you hear the most, I think.
They gave me hope. I had given up, but they gave me hope. They made me strong. Also, I had decided I wanted to volunteer because I wanted to give back. I wanted to help the people that helped me and really help people that didn't have insurance and didn't have like I didn't have. People need to know that a lot of times when you don't have good insurance, or you don't have no insurance at all, people need to know there is help and people will help you.
We provide so much more than medical care and medication. We provide encouragement. We provide education on the chronic diseases. We connect people to other services. But I think the most important thing we provide is hope. We give people hope that they can have a happy and a healthy and productive life. And we're so proud that we can be a part of that.
God bless me to come to the Forestry Health Center.